rolling.
All right, I'm gonna stand where Julia is so that.
And look at you.
Yep.
Everybody's
and
devices
actually,
off and here, put that. You want to put that?
You sure?
That's mine.
Oh, okay. Do you want to be the person in case it starts ringing to
Yep.
silence the vibrating? There we go.
Okay.
Everybody's got to have it in their hands.
Alrighty. So if you can look at the camera here. Okay. So we'll start off with having you list your name and your role here at Riverside.
Hello, my name is Dr. Alexandra Ward. I'm a cardiologist with Riverside Cardiology Specialists. My specialty is in non-invasive cardiology and in women's cardiovascular disease.
Awesome. Can you describe to us the type of medical care and procedures you provide? And specifically, can you go into the non-invasive treatments that you provide as opposed to what Dr. Chu might do with invasive treatments?
As a non-invasive cardiologist, I specialize in general cardiology, preventative cardiology, and imaging, of course. Imaging includes transthoracic echocardiogram, transesophageal echocardiogram, and stress testing, including treadmill stress testing, stress echocardiogram, and nuclear medicine stress testing. That's different than an interventional cardiologist in that I do not do any interventional procedures, so I do not do cardiac catheterizations, for example. However, non-invasive cardiology is an integral part of cardiology and the foundation for cardiology.
Awesome. Very well said. So what new technologies, if any, do you use when treating your patients? And how do they benefit our patients or allow us to provide the best care for them?
Non-invasive cardiology is continually growing, and as such there are great new innovations coming forward. One of the things we have started to use more recently is 3D echocardiography, which helps us to visualize structures in a 3D view as opposed to the standard 2D view that we've normally seen with echo. This helps in preparing for valve cases, both with interventional and our cardiac surgeons. In addition, we do diastolic stress testing and valve stress testing, which are again other modalities to help us determine the severity of disease processes, and that will impact patient care and treatment moving forward.
Awesome. And are these treatments and the resources that we have here at Riverside, are they readily available in the community, or is there anything that Riverside has that sets us apart from other health systems, or really is just a more localized resource for our patients rather?
Can you say that again for me?
So what I'm
that
trying to
into
get at is there's something that we're trying to highlight for our donors is that our patients have access to us here at home, and they don't have to travel to get this type of care. And then additionally, if there's anything that we provide that might be, sort of next level, cutting edge care that, again, they wouldn't have to travel for, they have access to right at home.
Can I talk about things that haven't happened yet?
Probably not.
Okay.
Where are they in the, just because they haven't happened, has a decision been made to do them?
And
I
has
think
it been announced?
It hasn't been announced, but I think the contract has been signed. I won't talk about it.
Okay, yeah, probably not if there's.
Oh, there's always next year. Don't worry.
Oh, yeah, so I was like,
yeah.
We'll be coming back to you.
Okay, okay, let me think of that.
Yeah. Take your time.
Technologies.
And if you need me to rephrase, I totally can too.
Yes, because when I'm trying to figure out how I'm going to say that back, to bring the question in.
Yeah, so maybe something about, at Riverside Cardiology, we're able to offer our patients things that allows their care to be close to home.
Okay.
And, these technologies are available so they don't have to travel.
At Riverside Cardiology Specialists, we are able to offer technologies that are cutting edge so that patients do not have to travel to other institutions or far away from home to get their testing done. So going back to that 3D, we can do 3D TEE, which does help with valve cases. We can do all the stress testing that we discussed and other imaging modalities. So we definitely do provide cutting edge imaging technology.
Awesome.
Is that good?
Yes.
Okay.
Yeah, that's great. That's exactly what I was getting at. Okay, so also, just any general updates that you might have as far as, or anything that you're really proud of that you guys are doing. So we, what?
We're also proud of ourselves.
Oh,
right?
I know, but this is the time to brag a little bit here. So we'll be sharing updates with our donors here. And so if you could tell us about some of the recent advancements just in cardiology care as a whole, and then also that you've incorporated into your practice.
And if you hear any of that going on in the background, you might want to just pause. Like I have a few
You've
minutes
got
ago.
good ears, come on, I don't know about.
You'll hear every word.
Cardiology is always advancing and quite rapidly, so there are always new technologies, new procedures, and new medications for our patients. I'm particularly proud at Riverside Cardiology that we incorporate the newest trial data into our practice. And particularly for myself, I am very interested in women's cardiovascular disease, and we have recently started a women's heart center here at Riverside that I am the director of. So that is something I'm very proud of and something that is cutting edge in cardiology today. We treat female patients and focus on cardio-obstetrics, complications of pregnancy, and disease processes that are more specific to our female patients.
Is there, correct me if I'm wrong, this is my ignorance, but is there like a stat about female heart disease and
Oh, yes.
maybe that you could reference
Which one would
in
you like?
relation to the women's center?
Well, and also, and I think that's a good segue to, I think a lot more people are afflicted by this than care to admit, acknowledge. I think fear is a big thing, particularly with women. They're always the caregiver. They're the, so if we're thinking that way, I mean, I can think about my mother. Like you'd have to shove her in here. What can we say about the way that your analysis and things take place in here that are comforting to people, and why should they be like calling their doctor tomorrow, calling you tomorrow? What is that, and what sets us apart in the services we provide for women here that you think?
Can I say I'm the only female cardiologist on the peninsula? Because I am.
Yeah, 100%.
As long as it's
Yeah.
true when this thing airs.
Brag on yourself.
Yeah, right.
Absolutely.
I think it's true.
But what's the personal
I want you to
spin
know
to
that.
it?
No, I think you're right.
I think
don't
I'm
know of
right.
anybody
Because a
else.
patient told me that.
Yeah.
And you're the only female cardiologist
At
at
Riverside.
Riverside, right?
Yes.
Mm-hmm.
Yeah.
Definitely.
So,
Yeah, I mean, I think that's
girl
very
power,
relatable.
100%.
And what would you, how would you address a patient where if they're like, oh gosh, there's probably a problem, I should probably go get help, but I don't want to know the answer. I mean, it's kind of same with cancer. People are like, I'd rather ignore it. But, what would you say to somebody to make them feel good about coming in?
Yeah, and maybe you could tie in being the only female cardiologist on the peninsula and at Riverside into valuing, women's cardiology specifically, and the, sort of the comfort and education that you're able to bring to the community.
The Women's Heart Center focuses, again, on women's cardiovascular disease, which is so important as cardiovascular disease is the #1 killer of women in America. That is a fact that is not well known, and most women are actually not aware of that fact. They're also not aware of the traditional and non-traditional risk factors that portend increased risk to cardiovascular disease. So the Women's Heart Center really focuses on prevention and education. So it is one of my biggest passions in education to the community, but also to providers, to let everyone know that this is a big problem, this is something we should be focusing on. And at the Women's Heart Center, we have a comprehensive approach where we discuss risk factors, again, education, and then we discuss what testing would be necessary, if any at all. And it really is a conversation between myself and the patient in talking about what's going on, answering any questions, and really easing any fears about diagnoses or testing. And as the only female cardiologist on the peninsula and at Riverside Cardiology, I take that role very seriously, and that's why I'm very excited to be starting the Women's Heart Center.
Oh,
That's
that's
great. That's so great. Yeah.
Yeah, I couldn't have said it better myself. That was great. That was perfect.
Okay. Are there any other support programs or anything like that you'd like to touch on that you can think of, or any other pieces of technology? And if you don't,
Well, thank you also too.
well, yeah, we'll get to that.
Cool.
But if anything that you can think of, and if not, that's totally fine. I think that we.
Yeah.
Okay.
I don't think so.
Awesome.
So I'm sure Ed went through all of that.
Yeah.
He did his was very technical actually.
Yes, I was gonna say, I'm sure it probably was.
Yeah.
So
I enjoy understanding what we're talking
Yeah.
about.
I will be less technical to balance him.
Yeah, well, and
No,
not that he's not warm, but you were very warm, and that is very nice.
People
too.
are accustomed to seeing a lot of male physicians, and
Right.
so it's nice to have like you're saying, a warm, because you can be cold, and then it kind of is sort of the same thing. And so the warm
Yeah.
is going to be really great for all of us.
And also just being, a kick-ass woman kind of.
Right? All of that.
So we love that for sure. Okay, so what does supporting Riverside Philanthropy mean to you? And do you have a message to those watching from home who continue to support Riverside and now the work that you do?
So that was the question I wanted help with.
Sure. Okay.
So what do I say to that?
So you're talking to a group of people who invest annually $1,000 or more, and
Okay.
that is one of our specialty donor clubs
Okay.
For annual giving. Actually, you're talking to everybody. It's the Founder
Yes.
Society too, so that's
Yeah.
even higher.
Yep, so our Founder Society actually is lifetime giving of $10,000 or more. So we have donors that'll be tuning in that have given $10,000
So $1 million.
$1 million or more even.
Mm-hmm.
And so they're just looking to hear, thank you so much for continuing to invest in the care that we provide at Riverside. And because of you, we're able to bring these new technologies into our practice. We're able to bring great care to our communities here at home so that our patients don't have to travel or that sort of thing.
Yeah, and even the
Yes, I like
basics.
that.
I don't. Did you? Last year we did cardio scales for Day of Giving, things like that. So even on a
Yes.
so even things like that, you got a ton of donors who donate to that project. Things on we may or may not have our cardio service line funding priorities put out yet, but we can speak to some of the things that went into play that help even on just the most basic level, things that people don't have to manage their own health. And so a heartfelt thank you for gifts here to here.
Small and large to help
Yeah.
our patient outcomes and, continue wellness within the community or something like that. Does
Yes.
that sound okay?
Should I say the Riverside Foundation, or how should I phrase the beginning?
You
To rephrase the question.
You certainly don't have to
Okay.
say the
Your
Riverside
support,
Foundation.
too,
Yeah,
Okay.
thank you just so much for your support of Riverside. I mean, the way we look at it, we are Riverside.
Yeah.
All of that money is coming straight to wherever it's designated.
A lot of times we don't say foundation because it's to Riverside. We don't
Okay.
like, we almost don't even like the connotation of you're giving to the Riverside Foundation. It's not you're giving to us, you're giving to Riverside.
Yeah, so
So should I say donations to Riverside, or should I say philanthropy? 'Cause
I
that's
would
a hard
just
word.
say thank you so much for your support.
Oh, perfect. Oh, that's,
Yeah.
Yeah.
that's even better.
Yeah, thank you so much for your continued support, because with your help, we're able to bring great care to the communities we serve.
Perfect. Thank you so much for your continued support of Riverside and Riverside Cardiology. In particular, we have been able to acquire scales for our patients all the way up to the newest and greatest technology, and all of those are incredibly important to providing state-of-the-art care to our patients right here at home on the peninsula. So your support is incredibly, incredibly important to us, and we are very grateful for it. So thank you very much. Do you want me to re-say that last line?
You can if you would like, but
It's up to you.
I think it's great. I think that was great. Yep.
Here, we have to get behind the scenes always.
Behind the scenes.
Try to avoid
Just need to
those.
do like a wave. One more wave.
Love it.
Got it. All right. Well, thank you.
Thank you.
Well, if you weren't having fun on a Thursday morning,
You might need to hook one of us up. The way we're feeling right now.
yeah, we might be coming back to you.
We're gonna
later
be.
tonight.
I was gonna say, we'll be your next patient.
Do you need help taking that off?